Let me start with something that surprises most of my patients. By age 60, nearly half of all men experience some degree of erectile difficulty, and that number continues to climb with each passing decade. But here's what often goes unsaid. Erectile dysfunction isn't just about what happens in the bedroom. It's often the first visible sign that something deeper is going on with your cardiovascular health, your metabolic function, or even your mental well-being. And too often, men blame themselves. They think it's just age. They think nothing can be done. They suffer in silence when there are real evidence-based solutions available. What if I told you that the lifestyle choices you make every single day, things like how you move, what you eat, how you sleep, could genuinely reverse or prevent erectile dysfunction naturally? That's exactly what we're going to talk about today. We'll cover what actually causes erectile dysfunction. We'll address the controversial question about pornography. And most importantly, I'll share the specific daily habits that can restore your function without medications. Before we dive in, where are you watching from? Drop your location in the comments. I love seeing how far this community reaches. I'm Dr. Narita, and I've spent the past 12 years helping men understand their bodies with clarity and compassion. So let's talk like I would with any patient sitting across from me with care, with evidence, and with zero judgment. First, let's understand what's actually happening when you get an erection. Your penis contains two spongy chambers called the corpora cavernosa. These are your erectile tissues. When you become aroused, your brain sends signals through your spinal cord to the nerves in your penis. These nerves release a molecule called nitric oxide. Think of nitric oxide as the ignition switch for erections. When it's released, the muscles in those spongy chambers relax, allowing blood to rush in. The pressure builds, the tissues expand, and this expansion compresses the veins around them, preventing blood from leaving. That's what creates and maintains firmness. Here's something remarkable. At rest, the oxygen levels in your penile tissues hover around 20 to 40 millimeters of mercury during an erection that nearly triples to 90 to 100. There's no other organ in your body with that much dynamic blood flow. This is why erections are such a powerful indicator of your overall vascular health. Now, let's talk about what goes wrong. Most men assume erectile dysfunction is purely physical, but the truth is more nuanced. There are 4 main categories, and understanding them changes everything. First, psychogenic causes. This is when psychological factors like stress, anxiety, depression, or relationship concerns interfere with your ability to get or maintain an erection. And here's what most men don't realize. Even if you have a physical issue, not being able to perform creates mental stress. That stress makes it harder to perform next time, and that becomes a vicious cycle. Performance anxiety is incredibly common. You go into an intimate moment worried about whether you'll perform. That worry triggers a stress response, and stress suppresses the very signals your body needs to create an erection. Second, vascular causes. This is the most common physical cause. When you have conditions like high blood pressure, high cholesterol, diabetes, or heart disease, your arteries become stiffer and narrower, less blood flows in, nitric oxide production drops, and those spongy tissues don't fill properly. Here's something critical. The arteries in your penis are significantly smaller than the arteries to your heart, about 1 to 2 millimeters compared to 3 to 4 millimeters. This means you'll notice blood flow problems in your penis years before you ever experience chest pain. Erectile dysfunction is often the canary in the coal mine for cardiovascular disease. Third, neurologic causes, conditions like spinal cord injury, multiple sclerosis, or surgeries in the pelvic area can damage the nerves that signal erections. Fourth, hormonal causes. While testosterone plays a role, only about 3% of erectile dysfunction is purely hormonal. Most cases are multifactorial. And then there are medications, antidepressants, blood pressure medications, antihistamines, and pain medications can all interfere with erectile function. If you're taking any of these, talk to your doctor about alternatives. Now let's address the million-dollar question. Does pornography cause erectile dysfunction? This is where I need to be very clear about what the research actually shows. Multiple studies have looked at men who use pornography, how frequently they use it, and their erectile function, and they have not found a direct causal correlation. However, and this is important, there are certain individuals who are at higher risk. If you have underlying depression, anxiety, stress, or moral incongruence with pornography use, meaning you feel conflicted about it based on your values, you may be more susceptible to psychogenic erectile dysfunction. You might also notice problems if you find yourself preferring masturbation with pornography over partnered intimacy. This can happen because you become habituated to very specific types of stimulation that are difficult to replicate in real life. The takeaway is that pornography itself isn't the villain, but your relationship with it matters if you feel it's becoming a substitute rather than a supplement that's worth examining. All right, now let's get to what you can actually do about this. First and foremost, treat your underlying health conditions. If you have high blood pressure, get it controlled. If you have diabetes, manage your blood sugar. If you have high cholesterol, address it. Without fixing these foundational issues, no amount of supplements or lifestyle changes will fully restore your function. Second, exercise, and I don't mean casually walking once a week. Randomized controlled trials, the gold standard of medical research, have shown that men who engage in 30 to 60 minutes of moderate aerobic exercise 3 to 5 times per week see statistically significant improvements in erectile function. We're talking about activities like brisk walking where you can hold a conversation but someone would know you're exercising, cycling, swimming, treadmill work. Why does this work? Because exercise improves blood vessel function. Healthier blood vessels produce more nitric oxide. More nitric oxide means better blood flow to your erectile tissues. And if you incorporate resistance training, you'll also see improvements in testosterone levels. Men with more severe erectile dysfunction actually see the greatest improvements from exercise. There's more room to improve, and the body responds. Third, prioritize sleep. Sleep is perhaps the most underutilized treatment in medicine. When you get quality sleep, meaning uninterrupted with adequate deep sleep and REM cycles, your testosterone production improves significantly. Studies show that men who sleep 7 hours or more with good sleep quality have better erectile function. And beyond directions, sleep improves your mental clarity, your mood, and your overall resilience. If you're not sleeping well, this alone could be sabotaging your performance. Fourth, optimize your diet. A 2020 study published in JAMA Network Open followed over 21,000 men for about 10 years. They found that men who followed a Mediterranean diet had the lowest risk of developing erectile dysfunction. This diet emphasizes plant-based foods, fruits, vegetables, whole grains, nuts, legumes, olive oil as your primary fat source, fish and poultry in moderate amounts, limited red meat, and herbs and spices instead of salt. The key is avoiding processed foods and focusing on whole natural ingredients. Specific foods that show promise include flavonoid-rich foods like apples, citrus fruits, grapes, onions, tea, dark chocolate, and kale. These contain antioxidants that reduce inflammation and improve blood vessel function. Omega-3 fatty acids from fish can help increase nitric oxide availability, and watermelon, interestingly, is rich in citrine, an amino acid that converts to arginine in your body. Arginine is a precursor for nitric oxide. Fifth, stop smoking. Smoking damages blood vessels and nerves. It lowers tissue elasticity. It can actually cause your penis to shrink due to reduced blood flow. Studies show that smoking increases your risk of erectile dysfunction by 50 to 116% compared to non-smokers. The good, News is that if you quit, especially if you're younger, you can restore healthy erectile function. Sixth, limit alcohol. In large amounts, alcohol is a sedative. It can cause temporary erectile dysfunction. Used chronically, it can affect your hormones and nerves, creating long-term issues. Try to limit yourself to less than 1 drink per day. Better yet, minimize alcohol entirely if you can. And seventh, avoid recreational drugs. Chronic use of amphetamines, cannabis, opioids, and other substances has been linked to erectile dysfunction. They can disrupt hormone production, damage blood vessel lining, and interfere with the neurological signals your body needs. Here's what I want you to remember. Erectile dysfunction is not a character flaw. It's not an inevitable consequence of aging. And it's certainly not something you should suffer through in silence. Your body is giving you information. And when you listen, when you address the underlying causes, when you make consistent daily choices that support your vascular health, your hormonal balance, and your mental well-being, you give your body what it needs to restore function. Small changes compound over time. Starting an exercise routine, improving your diet, getting better sleep, managing stress. These aren't just about erections. They're about your heart, your brain, your overall vitality. You deserve to feel capable, confident, and connected. And these changes can help you get there. If this information helped you understand your body a little better, take a moment and subscribe. I release new evidence-based content every week designed to help men over 60 reclaim their vitality naturally. And if you found value in this, share it with someone who might benefit. Sometimes the conversation we're most afraid to have is the one that changes everything. You still have so much life left to live. Your body is remarkably capable of recovery. It just needs the right support. I'm Dr. Narita. Thank you for watching.